And I wanted to talk to you about something that's been on my mind here recently quite a bit, and that's where orthodontics can really help. I mean, financially in restoring your mouth where you've got several missing teeth. And I just finished a video on a case that has three with 6-year molars that were bad, and we've put them back and closed that space up. She had lost earlier in life, lost one on the other side, so she has no 6-year molars, and we restored those teeth orthodontically. We took the second molars and brought them forward into the space, and the wisdom teeth followed along behind. And if the old person is old enough and the wisdom teeth are there, we put them in place. If not, we allow the wisdom teeth to develop and come in, and then we kind of tip them or whatever is necessary. We can upright a wisdom tooth that's sitting like this. We can set it up 10 years after you finish your orthodontics. If not, with this putting a little wire on there and putting a little acrylic bonding material on, you can set a wire on there to upright that wisdom tooth. So don't worry about that. We want to have something at the back of the line. You've got to have some teeth back there to fill this in. And we've been doing this for 40, 50 years. I've been taking teeth from the back of the mouth and moving them up into the front part of the mouth to fill in gaps. We use reverse head gears to pull the back teeth forward, or we come in with tads. Now we can put little screws in the bone on certain areas. If we don't want the front teeth to go back, we put tads in there and bond them to them or wire them to them, and that holds those teeth in place, and we pull the back teeth to the front to fill in the gaps. Now, if you take 2 or 3 or 4 teeth that are out and you're going to put implants in there, or you're going to put bridges to fill them in, the cost of it is far more. If you're going to have orthodontics done anyway, which most of these cases need, you can just work this into your orthodontics, and it costs very little more to close this space orthodontically than it would just to do the orthodontic case. We have shown you ways to take the arch wire and put a downward tip in it at the back, and as you pull it forward, it will cause the molar to come forward absolutely straight up and down. If you just pull on the molar, it'll lean over this way, you see. But we put this on it, and you can pull, and this downward bend in the arch wire will cause the roots to come forward. Now you just watch the molar come forward. If the roots get ahead of the crown, then you've got too much of this activation in the arch wire. Or if the crown is getting ahead of the roots, maybe you're pulling too hard with it, and your pulling is greater than the activation of the arch wire. So you can regulate it by just looking at how it's coming forward. Now, I'm interested in doing these complicated orthodontic cases, but I don't want people, now I'm saying this for general dentists or dentists anywhere that are doing orthodontics. This is perfectly fine, but don't jump in over your head. Start some of this. If you're interested in doing it, go and study these videos. We've going to have several of them showing you cases like this where we closed all the spaces. I've got one in there on a closing space on adults where there were all kinds of teeth to upright and close kind of spaces, and we're going to have bridges and implants and everything, and we just closed everything up. She needed one implant at the end because she didn't have a wisdom tooth back there to fill in, so we'll have them put an implant in that area. But orthodontics is wonderful for doing that, and so much more economical to restore your mouth. If you got, say, second molars and wisdom teeth and you lose your 6-year molars, we can close that up, and you be 9 out of 10 dentists won't even know you've had anything done. And that's this case that I'm going to put on. We've already put it out there. It's there. You can see it, what we do and how we do it. So anyway, I'm excited about having restorative dentistry through orthodontics. And so I think this is enough for you to understand and take this, and I hope you go back and look at these videos on that. Thank you for listening, and we hope you'll get in there with it and get with it. I don't want you to get over your head, but I want you to do it and know that you can do it. Okay, I'll wave goodbye.